Welcome to Parker Adventist Hospital TV. I'm joined by Dr. Derek Johnson, an orthopedic surgeon and medical director of joint replacement here at Parker Adventist Hospital. Dr. Johnson, who is a candidate for hip or knee replacement surgery?
Well, first of all, it has to be someone with clinical and radiographic evidence of arthritis, advanced arthritis. But more importantly, it's someone whose quality of life is significantly affected by the disability caused by arthritis. People who are unable to participate in the daily activities they enjoy, hiking, biking, golf, tennis, etc. And more than 50% of people with osteoarthritis consider their quality of life fair or poor because of the disability. And that's the ideal candidate for hip or knee replacement.
After surgery, how long does it typically take for a patient to get back to their normal activities?
Well, here at Parker Adventist, we're very progressive with our perioperative pain control as well as our physical therapy regimen. Most patients stay in the hospital 48 to 72 hours, and by 2 to 4 weeks after surgery, they're walking without any ambulatory aids. And somewhere between 4 to 6 weeks or 6 to 8 weeks, they're back to most of their leisure activities. They're able to start golfing, hiking, and biking and things within that time frame.
How long does a hip or knee replacement typically last?
Well, what the current data shows us is between 90 and 95% of people who have a hip or knee replacement still have that implant in functioning 15 to 20 years after the procedure. Some people have theirs last much longer. There are implants that have been in as long as 30 years. But what the data is currently showing is that 90 to 95% of people consider their joint replacement to be a good or excellent outcome at up to 15 years after surgery. And what that means is that even 15 to 20 years after surgery, they're able to participate in the activities, and they have an improvement in their quality of life as opposed to before their replacement, and they're still satisfied with their procedure.
Is there anyone that's considered too young to receive a hip or knee replacement?
Well, ideally, we would like someone to have their native knee for as long as possible, but again, it comes down to a quality of life issue. We're doing knee replacements and hip replacements patients that are younger and younger all the time. I've done hip and knee replacements in patients as young as 30 and 40 years old. And oftentimes they'll come to me and say, I've been told by other surgeons or other doctors that I am too young for knee or hip replacement. But when the quality of life reaches the point you're no longer participating in the activities you enjoy, I tend to think you're really too young to miss out on the things you could be doing if you had a hip or knee replacement at a younger age, given the fact that you may need a revision surgery down the road, but why miss that 15 or 20 years that you could have a well-functioning joint in your younger years?
Great. Thank you so much for answering our questions for us.
My pleasure. Thanks for having me.